Can you see it? Okay, okay. So last time we have left some few more viral diseases which are also important. Okay. So first one is about infectious bovine rhinotracheitis. In short, it is known as IBR, and the disease synonym is red nose. Okay. The affected bulls and this cattle, they used to show redness of the nose muzzle. Okay. So from a distance also it is very much clear, clinically manifested by redness of the muzzle and the nose. So that's why it is also known as red nose. I'll show you the picture this after this slide. Okay. And it is nothing but pathologically what happened is that it used to affect, this virus used to affect the upper respiratory tract of the animal. So they used to cause rhinotracheitis. Okay, rhinitis as well as tracheitis. That's why rhinotracheitis. And it is highly infectious type of this viral disease of cattle, goats, and pigs. Mainly this characterized by inflammation of the upper respiratory passages with pustular lesions on the male or female genital organs. Means mostly it is confined to the upper respiratory tract. Okay, sometimes a little bit up to the this lower. This this lungs can be, but mostly the upper respiratory tract. In addition to this, they used to affect the genital organs of the animal also, where pustular lesions means pus formation. Some pustules, vesicular lesion filled with this pustule, this pus. Okay, so that type of this very typical lesions used to be there in the genital organs. And the main clinical signs of the when we are talking about the this characteristic feature of this disease. So the upper respiratory tract, such as because of the infection of the upper respiratory tract, mucopurulent nasal discharges and hyperemic condition of the muzzle, leading to redness coloration, red coloration of the nose or the muzzle used to be there. Okay, so that's why what we call red nose or red nose disease. Okay, and little bit, this infection of the conjunctiva leading to conjunctivitis also with there. And clinically, 4 clinical forms of this IBR disease used to be there. Those are respiratory form, genital form, enteric form, and encephalitic form. Okay, means mostly confined, or you can say affect the respiratory system. But in some cases or some these animals, you may find the affection of the genital organs and the intestinal tract, GI tract, means enteric form, and even the CNS, encephalitic form. Okay, so here is the photograph showing it. If you see here, this last one and this one also, this necrotic, these plaques are there covering on the surface of the muzzle and all. If you remove all these things, like you'll find redness, red coloration of the muzzle and nose, right? So in this very particular this picture as I am showing, so it is very typically, this from a distance also you can view the affected animal showing such kind of this redness of the nose or the muzzle. So that's why the name, synonym red nose is given, right? And it is caused by a herpes virus known as bovine herpes virus, having 3 serotypes: bovine herpes virus 1, genotypes bovine herpes virus 1. Mainly that is responsible for the respiratory form, IBR. Okay, then the bovine herpes virus 2, that is mainly responsible for the this infectious pustular bulbovaginitis, in short IPV, and infectious melanocytis, IBP. Okay, so these are the genital forms. And the third genotype, that is bovine herpes virus 3, that is mainly involved or responsible for the encephalitic form, that is showing the neurological signs, right? And epidemiology, that it is not that much important, but please go through it, and I'm just skipping it. And occurrence and distribution also I'm skipping it, just go through it. Then coming to transmission, mainly the nasal and the ocular discharges coming out of the infected animals. So with that discharges coming out of this nasal as well as the ocular, so that used to contain these viral particles, and they used to go on shedding these virus particles along with these discharges, and can be detected for 10 to 14 days after the infection. That's why aerosol transmission means the aerosols coming out of this infected animal through these secretions. Okay, so aerosol transmission is the most important route of mode of transmission. But when the genital organ involvement where the pustular lesions used to be there, right? So in those cases, maybe in the male or maybe in the female, so in that case, venereal transmission is also possible. And when we are talking about carrier animals, okay, the virus can remain persist in the trigeminal ganglia, which can be reactivated, leading to viremic phases, and go on, this shedding the virus particle through the body excretions. Okay, so those animals which don't die and survive from this infection, and they may carry this virus in their body, and it can be excreted through the nasal as well as the ocular, and this secretions, discharges, and sometimes this virus can also remain this persisted, in the persistent in the trigeminal ganglia. After reactivation going into the circulation, then they used to be shedding out along with the body secretions. Okay, then coming to pathogenesis in the respiratory disease syndrome, that means main IBR, the respiratory involvement, the respiratory tract involvement. In that case, the virus replicates in the nasal cavity and the mucosa of the upper respiratory tract, mainly this nasal cavity and the upper respiratory tract means trachea mainly, right? And that may lead to inflammatory reaction of the nasal cavity, larynx, and the trachea. Then the virus used to spread towards the eyes, okay, leading to ocular lesions, developing some ocular lesions like this conjunctivitis with this excess lacrimation and this ocular discharges and all, right? Then the virus can become systemic and can localize in various tissues of the body, including the placenta. That results in fetal infection and abortion will occur, right? Means in pregnant animals, when they are, the virus is spread through the circulation and localized somewhere in the, this placenta, graviduterus. Okay, because of that, this it may lead to placentitis. Then means it may lead to fetal infection, okay, and abortion would be there, right? And sometimes localization of this virus can also occur in the brain, leading to encephalitis. That is in case of the encephalitic form, right? Now coming to clinical signs and symptoms, the clinical manifestations or the findings. So first one, in case of respiratory form, so incubation period may be varied 5 to 14 days, and it will be initiated with high rise of this body temperature, fever will be there, nasal and ocular, this ocular discharges, and red swollen conjunctiva of the affected animal will be there, right? And the animal will show drooping in the milk yield, and the breathing will be difficult. The animal will be, this may be showing this difficulty in breathing. So that's why breathing through the mouth, that means open mouth breathing. Okay, yes, I'm showing here. Okay, open mouth breathing means used to be there. And with that, salivation. Okay, so because of this salivation, sometimes those vesicular diseases like FMD and all these things, right? What we have discussed earlier. So sometimes it may be a little bit confused. That's why IBR was one of the differentiating and this point, and disease should be differentiated from those vesicular diseases and all, right? Then hyperemia, that means congestion of the nasal mucosa will be there, and necrotic lesions. Some necrotic areas can also be developed on the nasal septum. In between the nasal cavity, the partition used to be there, what we call nasal septum. There, some necrotic lesions, necrotic areas can be developed, right? And in some cases, sometimes secondary bacterial invasion may be there, or secondary this this virus and as well as some other these bacterial organisms. In those secondary these invasions and all, it may lead to pneumonic changes, particularly of bronchopneumonia type, right? And when gravid uterus is infected in case of the pregnant animals, then automatically there will be abortion, means due to placentitis and all, infection of the fetus, right? And so there will be abortion. Okay. Then these are some pictures showing, as I have already shown, this like this, and open mouth breathing and all, right? Nasal discharges and salivation and all. Then these are some more pictures showing very mucopurulent type of this discharges from the nostril. Little bit this seropurulent and this slight this mucus occurs. Then salivation is there from the open mouth breathing, and some this other lesions, as in case of the this mouth cavity and all. Sometimes some erosive lesions, okay, like this erosions, hemorrhagic lesions of the buccal mucosa, sometimes on the gum may also be there. So that's why it may be little bit confused with those vesicular diseases, right? FMD most commonly, right? Then these are some more, and this here, this salivation, then reddening and the conjunctiva and the mucopurulent discharges from the nostril, right? Then open mouth breathing with this the respiratory difficulty. So these are also open mouth breathing and this salivation from the mouth. Then in case of genital form, involvement of the genital organs, maybe in male or female. So in such cases, the animal, particularly in case of this female, used to have frequent urination and tail elevation because of the lesion, pastular, this vulvovaginitis, as I'm showing here, right? So they may feel pain when the tail is touching with this kind of this part of the genital organ, and that's why tail may remain elevated, okay, and with frequent urination. And some edematous swelling of the vulva, as well as the this formation of pastular lesions on the reddened vaginal mucosa, as I am showing here. Okay, many pastular lesions on the vagina and vulva will be there, and it will be swollen and edematous, right? And in such cases, you may have some mucoid or mucopurulent exudation discharges from the vagina like this. Okay, it may coming out of the this vagina, and the animal may show this exudation. So that may be like some pus material is coming out like. Okay, then in case of this enteric form, severe oral and the stomach necrotic lesions may be found in case of the newborn animals, and in such cases the animal may show high mortality. Then the fourth one, encephalitic form, that used to be mainly in case of these young calves, it used to be. Okay, and the animal, the young calves, where the brain is affected, okay, encephalitis used to be there and all. And they may show signs of depression, excitement with high mortality due to brain damage, right? So these are some from different sources, same thing. And this all, from different sources. So just go through it more or less same. Then coming to gross lesions, when you conduct post-mortem examination of this dead and these animals, the carcasses is just open and then you will find swelling and the congestion of the respiratory mucosal these surfaces, and there will be some acute inflammatory reaction on the larynx, trachea, as well as the bronchi, mostly to the upper respiratory tract. Then due to some secondary bacterial invasions, they may produce mucopurulent nasal discharges. Whenever thick mucopurulent, this pus-like materials used to be coming out of the nostril, these discharges are there, right? Then you can think of, and as well as some pneumonic changes used to be there, right? So in such cases, you can suspect that the animal has been already infected by secondary bacterial organisms and all, right? And there may be profuse fibrinome with this purulent exudation from the upper respiratory tract, in very severe cases, and the lung may show emphysema, and as well as secondary bronchopneumonia, and the cervical lymph nodes may be much swollen, and there may be, in some cases, conjunctivitis also, where edematous and the inflammatory reaction of the conjunctiva may be there with excessive lacrimation. Okay, and clear ocular discharges, initially they used to show very clear ocular discharges, and in progressing, the disease condition, when the disease progresses and all, it may turn to mucopurulent type of these discharges. And so for the enteric, this case is like there, you may this come across, or you may this observe chronic ulcerative type of this gastroenteritis in the feedlot cattle. Okay, in enteric form. So these are some of the this gross lesions showing the this acute inflammatory reaction, and these lesions on the nasal cavity. See, if you open the nasal cavity, you will find just kind of this very acute inflammatory reaction with high congestion and this exudation and all, and then maybe in the larynx as well as the trachea, some necrotic lesions and hemorrhagic as well as congestion and all, right? And sometimes, very thick, brown, this friable brown material. These are nothing but necrotic material, this mix up with the this pus material, pus exudates and all, right? So that may fill the windpipe, that means the trachea, or sometimes some part of the bronchi. Okay, so that used to be there also in the this bronchi as well as the trachea of the affected animal, very severe in these cases. Then these are some more just pictures of the nasal cavity showing necrotic lesion, congestion, and some fill with and this exudation, fibrinopurulent exudation, severe hemorrhagic lesions, and the necrotic changes there in the this trachea, another larynx and trachea. Okay, then in case of this, this this genital form. So this pastular, this bulbovaginitis, and as well as pastular melanopostitis. Okay, in case of this male. So in the penis and the prepuce and all, you will find pustules, pastular lesions and all. And in case of this female, the vulva and this vagina, so they may show those kind of this pastular lesions leading to this pus-like exudation from the affected animals and all. And when these fetus are affected, this leading to abortion and all, so you may come across, in the pregnant animals, when they are affected by this virus, IBR, then they may show this abortion and all, right? Then if you make the cross section of the nasal cavity, this is a nasal septum, some necrotic lesion used to be there. And sometimes it may fill the nostril by these plaques or this necrotic plaques along with the nasal fibrinopurulent, these discharges and all these things. So that's why the animal may have difficulty in breathing. So they, so open mouth breathing means breathing through the mouth. So that is because of this obstruction of the nasal passage by these necrotic plaques as well as the fibrinopurulent, mucopurulent, these discharges in the nasal cavity as well as this upper respiratory tract, right? And this is another pastular bulbovaginitis in female in case of this genital form. And these are also some more these lesions, like when this kind of this bovine herpes virus 1 infection. So mostly this pastular lesion formation used to be there and showing some ulcerative lesions of the epithelium of the upper respiratory tract, like this larynx and trachea most commonly, or sometimes in the genital organs, right? And there can be some severe necrotic ulcerative lesions also in the epithelium of the larynx and trachea in some of these cases. And when we are talking about the pneumonia, if pneumonia occurs, the changes are not pathognomonic and are due to combination of the effects of the virus as well as some secondary bacterial organisms. That means in such cases of this IBR and all these things, if the animal starts showing pneumonia, the signs of this pneumonia and all these things, then you can think of that it is not due to the virus, this very particular bovine herpes virus. So it may be due to the secondary bacterial invaders, mostly, these bacterial organisms and some other this viruses, other than this bovine herpes virus. So secondary bacterial invasions or secondary invaders may lead to severe form of this pneumonia, like this bronchopneumonia and all. right? Then histopathological changes in uncomplicated respiratory cases. That means when there is no any, the secondary invader, okay, only by this bovine herpes infection, then you may have acute catarrhal type of this inflammatory reaction where destruction of the epithelium of with necrotic foci in the larynges as well as epiglottal mucosa may be found and they may be observed. And some bronchopneumonic lesions can also this result from the bacterial complications. That means in complicated cases, when secondary invaders like bacterial invasions are there, then you may find the lesions of bronchopneumonia in this involvement of the, this lung alveoli, lungs portion just around the, your bronchi and all this, right? Then you may have, some cases of interstitial emphysema, though that is one of the reason for your labor bleeding, okay? And some lesions of rhinitis, laryngotracheitis, and bronchitis can also be observed. And most typically, intranuclear inclusion bodies can be observed, can be found out in the epithelial cells of the respiratory tract during the early stages of this infection. Okay, that is one of the important, this microscopic feature. And finally, diagnosis can be done on the basis of the clinical signs and symptoms and the PM findings, but you have to confirm, this disease by laboratory diagnosis, by this virus isolation, then direct fluorescent. It can be done by direct fluorescent antibody technique, ELISA, serum neutralization technique, and PCR, polymerase chain reaction, right? Then finally, the differential diagnosis. This disease may have similarity in the signs and symptoms or lesions with some of the diseases like pneumonic pasteurellosis, what we have already discussed, bovine viral diarrhea, malignant catarrhal fever, as well as the cough diphtheria. Okay, so that is all about this disease, IBR. This disease is about blue tongue. And the synonyms are sore muzzle, pseudo FMD, and muzzle disease. So these synonyms are also important so for your matching and sometimes in the this fill in the blanks or this multiple choice type of this question and all, right? Sore muzzle, sore. The term sore means some ulcerative type of this lesion, and when in this bed sore we used to say. The body part of the ventral portion or back portion when you are lying on the bed for long period and all this, we used to have some ulcerative erosive lesions and all. So like that in the muzzle, when that type of this erosive and ulcerative lesions used to be there, we call it sore, right? So muzzle may show, this sore, then it is almost looking like FMD like type of these lesions. Okay, there's signs and symptoms, even the lesions and all. So that's why pseudo means false FMD. Then muzzle disease, it is mainly confined to the muzzle and the tongue, of course. That's why the blue tongue, the tongue used to be, this turn into bluish discoloration and a very hard and firm type, right? So it is a very infectious type of this arthrophone-borne disease of the sheep mainly, and caused by a virus known as orbivirus. And the main characteristic feature of the disease is that edema and congestion of the face, cyanotic condition of the tongue, and endothelial hypoplastic changes leading to arthritis. Okay, and the affected animals used to, this show this high rise of this body temperature, pyrexia, catarrhal stomatitis, rhinitis, enteritis, dermatitis, myopathy, lameness, and finally death. Okay, so it is one kind of non-contagious. Sometimes in the question, like you may come across whether blue tongue is a contagious disease or not. Simply true or false, like blue tongue is a contagious disease, for example, of sheep. Means it is not contagious because it is arthropod-borne disease. Okay, means insect-borne or arthropod-borne. So that's why it is not a contagious one. Sometimes that type of this question also you may come across. Okay, so it is caused by this virus, orbivirus of the family Rheoviridae, having 26 serotypes worldwide, And out of these 6 serotypes isolated in the United States of America, whereas 21 serotypes have been reported from various parts of India. Okay, and it is, as I have already mentioned, it is non-contagious type and vector-borne, or this insect-borne type of this viral disease, mainly of the sheep. But sometimes some other animals like this cattle, goats, and deer, and even these carnivores also can be affected, but mostly they remain asymptomatic from this type of these infections. Okay, means they can be infected, right? And history part, I'm just skipping it. Please go through it. Okay. Then economic impact, as you know, this economic importance of the disease, as we have already discussed many times. So, mainly due to the trade restrictions and the involvement, of the your vaccination, treatment course, labor charge, and all these things. So, leading to economically important disease. This disease also, so it is one of economically important disease of the this sheep mainly. Okay, but sometimes in cattle also, right? Then coming to morbidity and mortality, as in case of this sheep. So the disease may be, this may be very severe form, but the severity of the disease may be depending upon some factors like the breed, the strain of the virus, as well as the environmental stress condition of the animal. So basing on this, or depending upon this, the severity of the disease also may be variable. Whereas the morbidity used to be very high, as much as, the 10%. Once, the disease outbreak is there, like the 10% population can be affected. But when we are talking about the mortality, it may be nil and zero, maybe maximum up to 30%, but it can reach up to 70% in highly susceptible sheep. Means the highest mortality rate may reach up to 70%. Means in that, highly susceptible type of this breed of the sheep, means if it is there, then only means it can reach up to 70%. And in case of this cattle, goat, and all, as I have already mentioned, mostly they remain asymptomatic, where the morbidity may be reaching up to 5% only. And the death is also very rare. They don't die much, from this infection, they don't die, right? Whereas in case of this deer and antelope, whenever they are affected, it will be a very severe type of this infection, and the morbidity will reach to 10%, as well as the mortality also used to be very high. That is 80 to 90% mortality used to be there. Okay. Then coming to transmission, the animal transmission. Okay, so mostly it can be transmitted by biting measles of the genus Culicoides. Okay, so there are some vectors, principal vectors, species of this Culicoides. Okay, as I have listed out here, according to different geographical locations in the United States, southern India, and other parts of this India and all. And other than this biting measles, this Culicoides, sometimes the ticks as well as the sheep cats can also transmit this infection and this virus. And sometimes, rarely, of course, this in utero infection can happen, and mechanical transmission can also be possible, but it is not much reported. So far, the venereal transmission is concerned, it is questionable. Okay, means it is not shown, it is not proof, but it is questionable, possibility is there, right? Then coming to pathogenesis, after the bite of these insects, biting measles, mostly the Culicoides, they used to suck the blood from the infected animals and all. Then they used to transmit by, these insects, biting insects like with Culicoides. Okay, and sometimes, insemination of an infected male. Okay, by using this infected semen of this infected male, that may be also responsible for infection, to the female. And the virus replication starts after getting into this body by the bite of this, biting measles mostly. So viral replication starts in the hemopoietic cells. Okay, then they used to go into the circulation, leading to viremia. There means they may replicate in the endothelial cells of the blood vessels, leading to the pathological changes so far the, this involvement of the injury to the this endothelial cells of the blood vessels are concerned. So as you know, we have learned already in the, associated this pathological condition of the vascular system, that is hyperemia, hemorrhage, edema, and thrombosis. And most of the animals, they may be very much anemic and they may show leukopenia. Okay. Then clinical signs and symptoms so far SIP are concerned. The incubation period of the disease may vary from 5 to 10 days, and majority of the cases may be asymptomatic. But whereas, the severe cases, characteristic feature and the classical forms are there, right? So in those cases, you will have this oral erosions and ulcerative lesions in the oral cavity. That is then the tongue. When we are talking about the, it is most commonly it is affected one, right? It used to be very much swollen, and they may remain protruded out of the mouth cavity, and it turns into blue in color, like cyanosis, right? Blue tongue. That's why the name, as I'm showing here. Okay, means the tongue used to be very hard and firm, swollen, and protruded out. It is coming out protruded out of the mouth cavity, and it turns into blue and this color, right? That's why blue tongue, right? And in case of the female, this use, this pregnant animals, in that case, due to the infection of this placenta, this gravis uterus and all this thing, reproductive failure mainly of this abortion used to be there, right? Then one very typical, in many of the question papers also fill in the blanks or somewhere in the, this you may come across bluish discoloration of the coronary band. That is known as bluish, this affected, as I am showing here, see, this coronary band, this area. Okay, so it is very typical, very much characteristic so far your, this affected, these SIPs are concerned. Okay, means inflammatory reaction of the coronary band. There you will find bluish discoloration. So this is very much typical so far, and this blue tongue and disease is concerned. And the animal used to show very much painful hoops. Because of that, they may show lameness. They may not be able to move. They may decline. Okay, then they will just lie down and on the floor and all, and they may remain lame, right? Then, and the face used to remain very much swollen. Okay, as I'm showing here, means swollen face, and sometimes the lip also. Okay, maybe swollen, and there may be some, this hemorrhagic lesions on the conjunctiva, conjunctival, and as well as the bulbar and this palpebral conjunctival hemorrhages. And sometimes the multiple hemorrhagic lesions may also be found on the conjunctiva, on the outer aspect of the nictitating and this membrane of the right eye. Okay, maybe sometimes on this left also. I'm showing here on this right one. That's why. Okay, so such kind of this multiple hemorrhagic lesions on the conjunctiva of the, the outer aspect of the nictitating membrane is also found in some of the cases. Then, so far the mouth cavity is concerned, from which, the animal may be confused with some other, this FMD or other vesicular lesions and all. So that those are mainly due to the extensive demarcated areas with reddening, okay, with small erosive lesions, okay, on this buccal mucosa, then as well as the gum and all, and sometimes, this ulcerative and necrotic lesions may also be found on the dental pad, and there may be thickening, reddening, as well as multifocal irregular, this erosive and these lesions on the mucocutaneous junction of the top lip, as well as this cranial aspect of the dental pad. Okay, so all these lesions of the mouth cavity, erosive, ulcerative lesions and all, so the animal may show even excessive salivation because of these lesions and all. So because of these lesions as well as salivation and all, that's why sometimes you may confuse with those vesicular diseases, mostly with FMD, right? Then if you manipulate, or if you examine the tongue properly, so they may remain very much reddening, hard and firm, showing extensive erosive lesions. And the mucosa of the dorsal aspect of the tongue, mostly they may show those kind of this extensive erosive and reddening and all, right? Sometimes some focal, this pitication or this petechial hemorrhages maybe also observed on the ventral aspect of the tongue, as I am showing here. Okay, so like this, some this hemorrhagic lesions, pinpoint hemorrhagic lesions can also be observed on the this ventral aspect of the tongue, like ventral portion. Then so far the affection of the in case of this gravid uterus is pregnant animal use as concerned. Okay, so they may lead to abortion, and most of the cases, those aborted fetuses, they may show torticollis. If you examine the aborted fetus, that there may be twisted neck of the this aborted fetus, and if it is born alive also. Okay, the newborn this kitten, this lambs, so that may also show such kind of this twisting and this twisted neck, what we call torticollis, right? Then in case of this cattle and the goats, as I have already mentioned you, that mostly they are asymptomatic, but sometimes they may show little bit mild form of this erosive lesions crusting around the nose and teeth, as I'm showing here. Sometimes little bit coronitis and reproductive failure. And so far the antelope or the hare are concerned, they are this very severely affected, as I have already mentioned, and this very high mortality, 80 to 90% mortality also used to be there, and there will be severe hemorrhagic lesions, and the most of the animal used to die from this infection. Okay, and in case of this cattle, mostly of course they may remain this asymptomatic. Wherever they may show some lesions and signs and symptoms and all, so that may be lacrimation. Okay, lacrimation from the infected this eyes and all, when conjunctivitis and all that. So lacrimation is very common, and some focally extensive area as well as hemorrhagic lesions on the tongue, means that is also there in this cattle. And sometimes some ulcerative lesions may be found on the muzzle. Okay, and such kind of this erosive, the superficial this erosive lesions on the tongue, as well as there may be some mucopollulant type of this nasal discharges from those affected these animals, right? And sometimes if you see this cornea also, sometimes you may find some ocular discharges from those infected animal, and the affected this cows by this blue tongue virus. So you may come across some edematous swelling of the udder, as I am showing here, of the affected cows. Okay, then PM findings, post-mortem examination and this findings and all. So in case of this sheep, mostly the face and the ears used to be very much edematous. They may show dry, crusty exudation on the nostrils, and the coronary bands, as I have already mentioned, this this bluish discoloration with some petechial and ecchymotic hemorrhagic lesions, and some this petechial or ulcerative as well as the erosive lesions can also be found on the oral cavity, buccal mucosa, tongue, as well as the dental this bed, and the necrotic and the cyanotic lesions on the oral mucosa are also common, and hyperemia, hemorrhagic lesions, as well as the edematous lesions may be found throughout the internal organs. Okay, and so far the this brain is concerned. Okay, sometimes in the newborn animals, lambs, okay, they may show hydranencephaly and cerebellar dysplasia. So far the cattle are concerned, the skin may be very much edematous, ulcerative lesions may be there, which used to be dry, thick with thick folds, right? And in case of the mouth cavity, you may have, you may come across some development or formation of vesicles, erosive this lesion leading to ulceration and necrotic lesions in the mouth cavity or buccal mucosa, right? So these are some of this picture showing one. This picture, here means I'm just showing that the lateral aspect of this tongue is very much, this well demarcated reddening with erosive lesions, as well as the pedicle, this pinpoint hemorrhage lesions on the ventral aspect of the tongue. And one very particular this lesion PM finding is that some multifocal type of these hemorrhagic lesions may be found at the base of the pulmonary artery. Okay, when you open the this heart, you know, the pulmonary artery which leads towards the lungs. Okay, this originated from the this right ventricle and all. So that may be, this just at the base of that pulmonary artery, you may find some hemorrhagic lesions, multiple hemorrhagic lesions like this. Okay, and such kind of this multiple well-demarcated intramural hemorrhagic lesions may also be found on the pulmonary artery, means inside the pulmonary artery. Then sometimes the subserosal multiple hemorrhagic lesions, multifocal hemorrhagic lesions may also be found on the spleen. Then sometimes on the abomasal mucosa at the pylorus end, okay, with dark and the red borders, that may also show some multifocal ulcerative lesions as I'm showing here. Okay. Then this kind of this multifocal hemorrhage lesions, as I have already mentioned you, that abomasal mucosa means may be mainly found at the pyloric end. Like this as I'm showing here. So multifocal, many of these areas showing these hemorrhagic lesions. Okay, and sometimes marked reddening of the jejunum mucosa of the the mucosal layer of the jejunum with sanguineous and mainly this sanguineous type of this content, blood mixed type of this content may be there in the jejunum when you open it. And these are some more these pictures, involvement of many other parts of the this body, this crusted muscle and the eroded this dental pad, the rumen showing multiple hemorrhagic lesions. Okay, then tongue which is also showing some exudation and the hyperemic condition, and the pedicle and hemorrhage lesions of the tip of the this tongue. Then bulbar and the palpebral conjunctival hemorrhage on this animal's eyes and all. And in case of this cattle, also similarly, that kind of this multifocal this hemorrhage lesions with edematous swelling, edema may be found on cut surface of the submandibular lymph nodes, and similar type of this extensive ecchymotic this cardial subepicardial hemorrhagic lesions may also be found on the this subepicardial this portion of the heart. And hemorrhagic lesions may also be found this on the ventricle, left ventricular this portion, and sometimes the bulbar conjunctiva and all these things, they may also show some this pinpoint hemorrhagic lesions. And the lymph nodes, almost all the lymph nodes, generalized type of this lymph node enlargement with edema. That's why leading to this much enlarged and juicy type of the edematous swelling of the this lymph nodes. Most of the lymph nodes used to be there. Okay, and one similar type of this lesion, the PM finding, which is also very important so far. The PM finding is concerned, and that is very much considered when you conduct the post-mortem examination as one of the most important lesion to be noted. For this disease, that is multifocal type of this hemorrhagic lesions at the base of the pulmonary artery, maybe in case of sheep as well as cattle. So that is important, right? Then microscopically, you may find hemorrhagic and the hemorrhagic lesions and the infiltration of this mononuclear chains when you see the tongue section. Okay, and the muscles of the coronary band, coronets, may also show hemorrhagic lesions, and many of these hemorrhagic lesions may also be found on the sections or in the sections of the abomasum as well as the intestine, with infiltration of many inflammatory cells, mostly neutrophils. And finally, diagnosis, which can be based on the clinical signs of the disease. But one this thing is that you can have a suspicion of this disease by those clinical signs, symptoms, and all these things. Then, if you want to confirm by the presence of, as I was talking about, the pinpoint hemorrhage, PTK or pinpoint hemorrhage lesions, sometimes ecchymotic hemorrhagic lesions, or multiple type of these critical hemorrhage lesions in the wall of the base of the pulmonary artery, as well as the focal necrotic lesions of the pulmonary and the papillary muscle of the left ventricle. Okay, so those are very much important. As means I have already shown also another picture also I am showing here. So this kind of this multifocal hemorrhage lesions in the wall of the pulmonary artery as well as at the base of the pulmonary artery, it is very much important. In association to this, some focal necrotic lesions of the papillary muscle of the left ventricle. Okay, then you may almost means your suspicion can be confirmed that maybe this, but so far I mean, the disease is concerned, as I have already mentioned, it is vector borne. I mean, these biting measles are involved, right? So that's why you have to, I mean, have the history of insect activity in the farm complex or the nearby, and the wasting of the or the food rot condition and all these things, right? And for confirmation for this isolation and identification of the virus and all in the laboratory. So for this, you may conduct many of these techniques like this ELISA and in this this immunofluorescent and this antibody technique, viral and virus neutralization test, PCR, serological techniques like complement fixation test and all, and even for examination of the protein levels and all these things, you can confirm that disease maybe this blue tongue. Okay, and finally, differential diagnosis. So there are many diseases which may have similar signs and symptoms, even the lesions with this blue tongue. Those are FMD, vesicular stomatitis, PPR, malignant catarrhal fever, bovine viral diarrhea, contagious pustular dermatitis, IBR, parainfluenza type 3, and this infection, chickenpox, foot rot, actinobacillosis, stress obvious infestation, as well as plant photosensitization. Okay, so these are the most of the important these viral diseases. Okay, so in the next class, some few these bacterial diseases we have left. So I'll take up those these bacterial diseases in the next class. Okay, so that's all for today. Yes. Yeah, you can say actually nowadays we don't use that much as pathognomonic the terminology. We used to say characteristic occurs. It is very much characteristic, and you can even use pathognomonic. Okay, means it is very much specific for this disease. Okay, so it means that's why in the PM finding, when you conduct post-mortem examination, you have to try to find out that kind of this multiple collagen type of these hemorrhagic lesions at the base of the pulmonary artery. And even if you open the pulmonary artery on the this ventral endocardium and that part and this effect at this side also, you may come across such type of this hemorrhagic lesion. Sometimes on the left side of the ventricle also, right? So that is very much important. And almost you can just use the term pathognomonic, but normally means we used to say nowadays this very much characteristic this gross lesion, right? Okay then. Thank you. Only in the this the trimester, third trimester. Actually, mainly when we are talking about the localization. Okay, means in some cases it is not in all the cases. In few cases, sometimes the virus can localize in the placenta. Okay, if it happens, then it will affect the gravid uterus and it will lead to placentitis and all, and it may kill the embryo. And this embryo will die because of this placentitis and all this thing. Okay, so abortion will be there, it will be aborted out. So that may be this in the mainly in the trimester and the third trimester and all this, right? Sometimes of course little bit early abortion can also be occur. So exact this gestation period is not given as per your literature is also concerned. Okay, means in which stage of the pregnancy, it will be. So maybe in the early abortion also, maybe little bit late. Mostly the early abortion is more, just common, it will be common. Okay, if localization of this virus used to be there in the gravid uterus, okay, leading to placentitis, right? Okay, thank you. Today, actually, I have some, this one. Can you send a message? Just send me message. I will just go through it and I will give you the reply. Okay. Please send me this message.